Welcome everybody to our third Researchers Unmasked webinar. I want to start just by making the land acknowledgement. I am in the city of Toronto, and this is the traditional land of the Huron-Wendat, the Seneca, and most recently the Mississaugas of the Credit River. Today, it's still the home of many Indigenous people from across Turtle Island, and I am grateful to have the opportunity to work and live on this land. And I'll introduce Leslie Pritchard in just a second, but Leslie, if you'd like to make the land acknowledgement for Edmonton.
Yes, thanks, Eric. I'd like to acknowledge the land on which I am very grateful to work and live, which is Treaty 6 territory, and a traditional meeting ground and home for many Indigenous peoples, including Cree, Saulteaux, Blackfoot, Métis, and Nakota Sioux.
Excellent, thank you. So, hi everybody. Again, I'm Eric Benchamal. I'm co-chair of the CCH-CSP Curriculum Committee, and I'd like to welcome everybody to our third new CCH-CSP series on Researchers Unmasked, which is aimed at interviewing various teams and individual researchers engaged in pediatric research in Canada and who are engaged in the CCH-CSP community in some way and giving away some of their secrets to their success. I'd like to introduce my co-host for this webinar, Dr. Leslie Pritchard, who's an associate professor in the Faculty of Rehab Medicine at University of Alberta. Leslie and I are both longtime CCH-CSPers, and we're actually trainees with our guest today. Hi, Leslie.
Hi, thanks, Eric. Mandy Archibald was the co-host for the first two Researchers Unmasked webinars, but she's happily on maternity leave this year. So I'll be stepping in for her today. As Eric mentioned, this is our third webinar in the series that aims to allow successful child health clinician researchers to tell their stories to our trainees in their own words. So we really aim to give trainees a personal view of how these research paved their way to a successful career. So our guest today is Dr. Shannon MacDonald. Shannon is an associate professor in the Faculty of Nursing and adjunct faculty in the School of Public Health at the University of Alberta. Her program of research focuses on vaccine hesitancy, uptake and safety, with an emphasis on supporting immunization best practice and policies. Obviously a very important topic this year, particularly as we are about to embark on the COVID-19 vaccine rollout for children this week. Shannon has a particular interest in addressing system-level barriers and supports to achieving high immunization coverage, particularly in underserved populations. Shannon, welcome, and please introduce yourself.
Thank you very much. And I am also, like Leslie, on Treaty 6 territory here in Edmonton, Alberta. Nice to see everybody here today. Thanks for joining us. So I am, as Leslie said, an associate professor in the Faculty of Nursing and School of Public Health at the University of Alberta. And my position here is a combination of research, teaching, and service. I supervise students in the PhD program, as well as master's and undergrad honors students in both nursing and public health. And I'm not sure, do you want me to go on with more introduction, or is that enough to get us started?
So whatever you prefer. I'd love to hear what your most memorable experience from your time training at CCH-CSP was, considering we were all trainees together.
Yes. Yeah. So I went through as a CCH-CSP trainee as a PhD student, and then again as a new career investigator. And Leslie and Eric and I have crossed paths many times. Eric and I went to the Netherlands together, which is a great opportunity that CCH-CSP has been able to offer, where we went to meet with sort of the equivalent there. It's called Tulips. And we did a grant writing workshop. And we were just talking about those times. I would say that is a noteworthy event, riding bicycles from pub to pub. You can imagine the bicycles got a little wobblier with every stop. So not an academic memory, but a very powerful and pleasant memory from CCH-CSP.
Yeah. And snacking on waffles and bits and balls. Which
yeah,
is
exactly.
Bikes, beer, bits and balls is probably the stereotypical Dutch thing to do, I guess. That was great.
Yeah, yeah.
All right, so we're going to start with some pre-submitted questions for you, Shannon. We'll be sure to leave at least 20 minutes for questions from the audience. And so what I would ask is, as Linda put in the chat box, if you can actually type in your questions into the Q&A box, and that will go to Linda. Linda will sort of monitor the questions and help us answer them later during the Q&A period. You can also put them in the chat box, but it's probably better in the Q&A box so that we can keep track. Unfortunately, we can't, I guess, unmute on this type of webinar to ask your question verbally. So the Q&A box is the best way. So you mentioned your involvement in CCH-CSP over the years, but can you tell us a little bit about your clinical background and your research training and what you've done over the years in that way?
Sure. I'll tell you a bit about my journey, and hopefully folks who are calling in today can see themselves at different points along this journey. So I'm a nurse by clinical background. My clinical area was the pediatric intensive care unit. So after I graduated as a nurse in Newfoundland, I worked in pediatric ICU in Newfoundland. I went down to the US for a number of years and worked in North Carolina in a pediatric ICU before deciding to pursue graduate training. So I came back to Canada to do that and did my Master's of Nursing, focusing on population and public health in a project based in Indonesia, and also had the opportunity to travel to Ghana for some of my work there. After I did my master's, I taught at the university in Newfoundland and also at Dalhousie in Halifax for a few years, and then decided it was time to take my next step in my graduate training. So I moved to Edmonton, which is actually where I'm from originally, moved to Edmonton to do my PhD degree in the Faculty of Nursing, and did most of my training actually in the School of Public Health, but for career reasons decided I wanted my PhD to be in nursing, in terms of I knew I wanted an academic position, and there is a shortage of PhD prepared nursing faculty in Canada. So my PhD is in nursing. My training sort of crosses those two boundaries. When I finished my PhD, I did a postdoctoral fellowship in the Department of Pediatrics at the University of Calgary. And during that time, I was embedded at the Ministry of Health in Alberta. So I essentially had an office at Alberta Health, where I had the opportunity to, sit in on meetings around public health policy, decision-making, hear from policy advisors firsthand, like what their questions were around immunization and whatnot. And so I was really able to develop a research program that directly feeds back to policymakers information on the questions they have. So I was doing a lot of policy related work then, and then have continued to do that as well as more clinical work. So I also now have a lot of collaborations with clinical sites in public health centers in Edmonton, as well as a First Nations community near Edmonton, where I work with the nursing team there, as well as sometimes do things like information sessions for parents and things like that. So the research I do, I lead a research team. It's called the Applied Immunization Research Program. And we're really focused on looking at how we can improve how immunization services are provided. So there's, didn't silence my phone there. There's certainly lots of work to be done around, how do we change people's minds about vaccines? But my program more focuses on how do we make the system work smarter in the delivery of vaccines so people don't have to work so hard. So how do we get them the information they need in a way they can understand? How do we provide a service in a way that they can access in settings that they can access? How do we ensure that they're welcome and non-discriminated against when they access service? How do we ensure they have a positive immunization experience, good management of pain, and things like that? So that's the kind of work we do. And I guess you would label me as a bit of a quantoid. I love numbers. My preferred methods are always things like administrative health data, surveys, environmental scans. But I've learned over the years that I really need to augment with some qualitative methods, because I can't always answer the why questions with numbers. And so I often have folks on my team who have expertise in qualitative methods, so that we can involve things like interviews, and institutional ethnography as approach that we've used before. So that's the sort of work I do. And then I think the only other thing to mention is that I am also a wife and mom and recent dog owner. And so I think it's important to always remember that we're not just this academic being who sits in an office, but we're all trying to juggle all those other things that are going on in our lives.
Thanks. And I think I found it's interesting that you've acknowledged the importance of qualitative methods in your research, even though you're not an expert, very much like I have. I think I remember back to when we were trainees, interacting with qualitative researchers and, you know, not quite understanding what they did and sort of debating the importance of each of our different types of research. And I think as we've aged, we've probably grown up a little bit, matured a little bit, and recognized that you need both, right? And I think a lot of these studies need both put together. And so it's not enough just to be a quant. You need those qualitative researchers involved. So with that, I mean, I think that's probably one of the things that CCH-CSP contributed to your career and contributed to your training was that, you know, cross-pollination with different types of researchers. But what else do you think CCH-CSP contributed as you went? Yeah.
So, you know, as someone who did her graduate training in nursing, we get exposed quite a bit to qualitative. So I knew academically, you know, what it was all about, but certainly interacting with folks who live and breathe qualitative research and are champions of qualitative research was important. I would say that as well as I think the big thing for me with CCH-CSP is the interdisciplinary aspect of it. And I know we all run around with like this interdisciplinary is good flag waving, but you know, what does that actually mean? And so I was thinking about this the other day. How has it improved me as a researcher? The ability to interact with trainees and early career investigators who are coming from completely different training backgrounds and different paradigms. And I think honestly, a lot of it is that it's given me the confidence to work with interdisciplinary teams and understand that I have as much right to lead these teams as anybody else. So in nursing, there is historically this sort of hierarchical approach about where nurses sit in the pecking order and, you know, who's in charge. And of course, what the subtext to that is, you know, nurses have historically been under, you know, a hierarchy with medicine, right? And nursing is very much sort of like fighting its way out of that still. And I find sometimes in the research environment, I encounter physicians who actually don't have research training, but are trying to run research projects. And I am a trained researcher and I'm thinking, hang on, I actually know more than this person about research. So I think one of the things that CCH-CSP gave me is I know how much I know, and I know where I sort of sit in, and I am as well trained as any other researcher out there, and it really is a level playing field. I don't feel any kind of adversity towards, you know, my other interdisciplinary colleagues, but I just honestly feel like I'm just on a level playing field. I know where my skills are and where their skills are. And I think it's taken some of that sort of like angst and mystery out of working with colleagues in other disciplines. I don't know if that makes sense to people, but I still am shocked when I go into a room with a research team and people defer to, you know, the medical officer of health because they're a physician on all issues, regardless of that's what their training is in, and research is one that they don't necessarily have more research training than me in. So I feel like it's given me confidence.
That's good. I'm going to follow that up. Sorry, Leslie, for just a second. Did you ever feel imposter syndrome? Like, did you ever feel like you didn't belong, especially at the beginning of your career? It seems to be very common that, you know, you're in a room full of people who maybe are more senior. How did you start to feel that confidence? How did you start to feel like you belonged and you deserved to be there?
Yeah, I mean, imposter syndrome is something I think it comes in waves for everybody. I mean, I can't speak for everybody, but for me, it comes in waves. I feel like I'm on top of things, and then something happens and I think, oh, do I actually know anything? Do I have a right to be here? So I think it's just something we all have to live with and acknowledge that at times we feel a little out of our depth. I think the thing I sometimes struggle with personally is that I'm a nurse researcher who researches a subject that nurses for some reason are not researching. So immunization is an area that is either, you know, the research tends to be physician-led, public health, you know, led, or a combination of both. And I've always been pretty much the only nurse in the room when these, like nurse researcher in the room when these conversations happen. So for instance, every 2 years I go to the Canadian Immunization Conference, and there's, you know, 800 people there, and they're either physicians, researchers, or public health nurses who provide vaccines. And the researchers are a totally different entity than the nurses. So when I introduce myself as a nurse, people say, oh, so you vaccinate? Nope, I don't vaccinate. Oh, so you're like the research nurse who works for Dr. So-and-so. I'm like, nope, I am the Dr. So-and-so. So I think that's where sometimes I struggle, is that because in my field, there's not a lot of nurses working, I'm a bit of an outlier. So I've made it a mission to try and change that. And I have a nice, healthy contingent of trainees that I think will be fantastic leaders in this field in the future.
So Shannon, I can certainly relate to your experience with imposter syndrome. And I was thinking as you're talking that I always thought that it would go away. And I think as time goes on, I've just learned how to embrace it and how to manage it differently. But it's definitely still there. And I think many people experience the same thing. And I can also relate to what you said about CCH-CSP in terms of confidence, but also in terms of, you know, helping to develop a sense of identity as a clinician scientist as well. So I really want to delve into the content of your research, and wondering if you can talk a little bit about what led you to focus on immunization in your research program.
Sure. So my master's degree, as I mentioned, I did some work in Indonesia for that. And my project was actually the home treatment of childhood diarrhea. So in developing countries, diarrhea is the second leading cause of death in children under the age of 5. And I knew I was interested in children, and I wanted to do international health, and that's the project I did. When I was in Indonesia and then in Ghana later on in my master's, I could not get over the number of times I met parents. And I'll warn you, I have a very leaky faucet, and I talk about this stuff, it makes me upset. The number of times I met parents who you'd ask them, for instance, how many kids they have, and they'd say, how many do I have now? Or like, how many have I given birth to? And the story was always very similar. I had a baby, it got a cough, it died. I had a baby, it got diarrhea, it died. I had a baby, I don't know what happened, but it died. And most of the time they were diseases that were vaccine preventable diseases. So like this thought of there's babies dying from diseases we could be preventing. So I come back from, see, I told you I'd cry. I come back from that experience. You know, I had been working in intensive care, and I was reflecting on some of the kids that I'd been caring for in intensive care. And there were kids that were on ventilators because they had whooping cough. There were kids who were losing limbs because they had meningococcemia. You know, there were kids who were getting vaccine preventable diseases. Now, some of them were not vaccine preventable at the time. Like when I was caring for these kids, we didn't have as good a meningococcal vaccines as we do now. But as I thought back about that, I thought, we've got kids dying from lack of access to vaccines. We've got kids dying because their parents are choosing not to give them vaccines. Like, what the heck is going on here? So that's really, my passion was really ignited by a combination of my clinical and international health experiences. And funnily enough, when I started my PhD, which was in 2005, I couldn't get any funding for my project because nobody thought it was a good idea. I literally had reviewer feedback that said, why would you study the reasons why parents don't vaccinate their children? Everybody vaccinates their children. So fast forward to 2021. Yeah, so literally, as I started my PhD, people were telling me my topic was a non-topic. And by the time I finished my PhD, I was drowning in research ideas and opportunities. So it's not because I did anything fantastic. It's just that the landscape changed.
Yeah, or our awareness changed, I guess, with it. So let's talk about that. It's COVID, it's 2021. Immunizations are pretty much all we're talking about now. So obviously it's impacted research programs in different ways. The pandemic has impacted research programs in very different ways, with many researchers having to pause their research activities entirely, people like me switching over to a more virtual model. How did the pandemic impact your research program?
Yeah, I would say it probably had the opposite effect that it did for most people. It basically accelerated and ramped up my research program. So there were certainly some projects that I had to pause and rethink or just pause on. So for instance, we have a project working with a First Nations community near Edmonton where we were going out there doing observations and interviews and whatnot. And, in consultation with my partners out there, we said, not a good idea for me to be coming to and from Edmonton to your community in the middle of a pandemic, pre-vaccine particularly. So we just agreed, hit pause, we'll revisit things later. But there were other projects that we were already started on that became even more important. So we had one project where we were trialing a text message intervention to remind parents about attending vaccine appointments. So just like, and it always bothered me that, my hairdresser gave me a text to tell me my hair appointment was coming up, but the health center didn't give me a text to tell me my appointment for my child's vaccines were coming up. So we were in the middle of that. And that information has been really helpful. We've been feeding that back to our partners in Alberta Health Services around the value of text message reminders. And then, of course, I'm sure, if you've looked at any grant calls over the last 2 years, there's been almost a grotesque amount of funding available for COVID-related research. So, I did have the opportunity to apply for additional funding and was successful in a number of opportunities. And so COVID vaccine related research certainly became a bigger part of the portfolio of projects that I work on. And I think the biggest challenge for me has actually been managing the workload. So, every time we'd get sort of a notification from the university that, we understand your work has been impacted and you're not going to be as productive as you were in the, before the pandemic. I was always like, oh my gosh, sometimes I wish I was that person who was at home learning a new hobby. My workload has just, it's gone through the roof, but it's resulted in some great opportunities. Like I'm leading teams of researchers that I've never led before because I got my foot in the door early, and it snowballed. So, we got one CIHR grant, and then somebody said, well, if we give you a bit more money, could you add this to your study? And then somebody else, if we give you more money, can you add this to your study? And it just sort of balloons. So it's been
rough problems to have for
and it feels a bit weird to be complaining.
It's the researcher equivalent of first world problems there.
It's like, oh gosh, I have too much money and, I don't have time to write all the publications that I could get out. But honestly, from a personal perspective, it has been a challenge. My family has, it's been challenging on my family.
Yeah, and I think we'll probably get to that, I think, as a separate topic, but that's important to recognize. So now you didn't have to really pivot for this COVID-19 funding that came out, that large amount of funding. Others in the audience may be thinking about pivoting or may have already. So, what's your feeling on that, right? The people who weren't anywhere near the infectious disease or epi or COVID space and pivoted to get some of that COVID funding. And where do you see that going? Do you think that they should be continuing down that path, or do you think that that gravy train is kind of done?
Yeah, it's a really good point. I maybe have a slightly different perspective on it because I have lived and breathed vaccination for, the last 15 years. As all these funding opportunities came out, I was being contacted by people who'd never thought about vaccines before, saying, I want to apply for some of this funding. So although I study, well, this is actually a real example, extremist terrorism, I want to find a way to study vaccines because there's funding and somebody says I can get this data set on blah, 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 blah. Can you be a co-investigator on my project? So I dealt with a number of things like that where I'm like, this person has no business studying vaccines. It's not something you just sort of pick up and say, I'm going to be an expert. But then there were folks who had more thoughtfully considered, okay, how, like we were talking about your IBD work, Eric, like how has the pandemic influenced, patients with IBD, inflammatory bowel disease? Or I was contacted by someone who said, I work in correctional facilities around health promotion. I'm interested in understanding whether, inmates in correctional facilities are planning to get vaccinated, what their barriers and beliefs are. So I think if there's a logical segue of why it makes sense to study COVID or COVID vaccines in your population, that I think it's a great opportunity to take advantage of the funding. But if your research truly has nothing to do with this and isn't going to be impacted by this, I don't think it's smart. It's not good science. It has the potential to produce dangerous outputs if you don't know what you're talking about, and I think it's going to sidetrack your real work if you sort of jump on this bandwagon, and then at the end of the pandemic you jump off the bandwagon and go back to what you were doing before. I don't think you're going to be any further ahead. So I think it's being self-aware enough to know whether or not it's a good fit with the research that you're doing. And I don't know in terms of whether the gravy train is ending or not. I don't know. It's so hard to say whether, I'd like to say the pandemic is winding down, but until it's winding down, I'm not convinced. So it's hard to know how long this will continue.
Yeah, and I want to emphasize what you said, that it's not just about the topic area, right? It's not just that you've never done COVID research or never done vaccine research before. It's also the methods. So you and I both do health research with health administrative data, and we've both seen horrible research come out over the past year using health administrative data from people who just simply didn't know how to use those data for research. So I think you have to be very cautious, obviously, and play to your expertise, but also get good collaborators like you, Shannon, who would be able to help with that type of research.
So Shannon, I know you've spent a lot of time, changing the topic slightly, thinking about mentorship, because I've been to several of your excellent presentations over the last few years on the qualities that make that relationship effective. And so I'm wondering if you can talk a little bit about your team, who's on your team, the trainees that you have working with you, and how did you come to work with those trainees on your team? How did you choose them?
So I'll start off by saying I'm probably not a good model for anybody to follow. Let's frame this as learn from my mistakes. So when I started my faculty position, I asked lots of people, what's the right number of trainees to have, or what's the right mix of trainees to have? And I just kept getting answers like, oh, it's different for everybody, or it varies, or it depends. So I just kept accepting trainees because I didn't know when enough was enough. I now probably have much too big a group of trainees, which isn't ideal for the trainees, and it's not ideal for me. So just to give you some context. So I'm just looking at my numbers here. I have 6 PhD students, which I think in itself is too many. I have 2 Masters of Science in Epidemiology students. I have 4 Masters of Nursing students, and I have 4 honors students. It basically means that I spend at least half my week in meetings with trainees, and that they end up having to wait a little longer for feedback from me than I would like. Now, I think I'm keeping us all our heads above water, and that's because I've hired a couple of full-time staff members who help me with some of the administrative aspects around, the paperwork and things like that. And I've also started doing, we call it sort of like multi-level, what's the language we've been using? I've tried to avoid the word hierarchical, but it's like multi-level mentorship. So I've matched all my PhDs with master's students, my master's students with honors students, so that, for instance, if there's a master's student project, they have a PhD student who's co-mentoring them with me. And so if I'm not immediately available, they can go to the PhD student. And actually that's the model we have, is go to the PhD student first, with your question. And if they can't answer it, then come to me. And so it happened as sort of a survival mechanism, but even when I think I'm get myself back to the right number, I'm going to keep it, because I can't get over how much the PhD students have developed as mentors, and actually how much the master's students have learned to appreciate, you know, what's the next step of my graduate training? What does that look like? What does a PhD student look like? What kind of expertise do they have? What kind of projects are they working on? So I definitely will keep that. I need to sort of stop accepting students and let a few of them graduate and get myself to a point where I feel like I'm not doing them a disservice by being not as available as I wish I was.
That's a really good point, Shannon. And I've found something similar, and that I've learned over the last few years, is the value of having that mentorship experience for trainees. I think it's really, really important, more important than I initially realized. I'm just wondering, can you talk a little bit about the funding for your trainees and how that works within your program?
Sure. So, I mean, as I mentioned, I've been fortunate in terms of my funding situation lately. So I do have enough funding right now that I can offer funding for all of my PhD trainees and many of my master's trainees. So basically, if the master's trainees are doing a thesis, I offer them funding. If they're doing a capstone project, they don't always have the opportunity to have funding, just because they've sort of self-declared as being not as research focused. So the model I use, and this is sort of driven by the way things function at the U of A, I don't give them a stipend. I actually just hire them as a research assistant. So I don't know, Leslie, if you run into this. I was told that if I give students a stipend, I can't attach any deliverables to it. I just basically say, here's $15,000, you know, for your work, go have fun. Or I don't know, like I can't say, I expect you to help on this systematic review, or I expect you to help with cleaning this data or whatnot. And I think, in addition to the funding, I think those are the experiences that the trainees really benefit from. So I've been able to include those more senior trainees in a lot of the projects. They're helping me develop interview guides. They're helping me test interview guides. They're helping me clean data. They're helping me develop interview guides. And so I try to match them on projects that are in line with what they're going to do in their thesis. So if someone's going to do a survey for their thesis, I try to involve them in a project where we're doing a survey, et cetera, et cetera. So it's worked out really well. Yeah, I think that's sort of my main point. I won't keep talking, because I'm just mindful that we should leave time for
Yes, we're getting close to the question time for sure. And yes, our system is exactly the same way in terms of stipends and research assistantships as well. So the deliverables can be attached to the RA position. Yeah. Something that I struggle with a lot is, you know, how do you find trainees that are a good fit for you and for your team? Especially, you know, sometimes my experience, especially if you don't live in the same area, or now because of the pandemic, you know, you're meeting people online for brief amounts of time, and you do spend a lot of time together, you know, particularly when you're doing a PhD. So what's the process you use to decide who's going to be on your team?
Yeah. Again, I think it's more like learn from my trial and error approach. I don't think I really knew how to go about it. And when I started as a faculty member, I was quite stressed about, how do I find graduate students? And now my issue is, how do I filter through the graduate students who are finding me to figure out who is a good fit and has, you know, the right complement of skills and experience to do well. So I think, you know, the first part, if you're going looking for trainees, I mean, I honestly think word of mouth, you know, from colleagues that I trust pays dividends, right? It's way nicer to say, you know, have a colleague, like I had a colleague in Calgary who's like, I have this, you know, honor student that just graduated and she's interested in doing her master's and she's fantastic. You know, that's the kind of thing you want to get, for sure. So I always, you know, meet with people, Zoom call lately, of course. I like to see their CV, their transcript. I like to see an example of their writing, acknowledging whatever they send me is probably going to be something that's been, vetted and reviewed by multiple people, because it's probably a manuscript or a course paper or something like that. But, getting a sense of where their writing skills are at. I'm finding more and more students who have poor writing skills are like twice, 3 times, 4 times the investment of my time than a student who comes in with strong writing skills. And that doesn't mean I won't take somebody if they don't have strong writing skills, but I won't take multiple people if writing, if I have a trainee who's requiring a lot more feedback and whatnot, I try not to then take another trainee who looks like maybe they have that same challenge. So it's that thing of finding the right mix. Yeah.
And so I agree with you. I feel the same about when a colleague contacts me, but what about those students out there who maybe aren't connected to a colleague? What sort of grabs your attention when they're trying to connect with you by email? And perhaps before you answer, I'll just remind everyone that we have about 20 minutes left. So feel free to put your questions in the Q&A box. And I think Eric and I can keep asking questions, but we really like to go to your questions if you have any for Shannon.
Sure. So I feel like I could do a whole presentation on how to cold call a potential supervisor, because there are some definite lists of things not to do. So, I probably get, well, it depends on the time of year. When, grad intake is happening, I get more emails. But when you get an email that says, dear professor, I'm interested in working under your supervision because I'm really interested in elderly people with Alzheimer's. Obviously that person has not actually read what I do or even looked at my profile online. So that is not the way to go. And even the ones that are just super vague, where it's like, I love what you do, I want to do what you do, tell me what project you want me to work on and I'll work on it. That also, it does not hold a great deal of appeal, because again, it shows that they haven't really thought about what they're interested in, and they haven't looked at what I do. And honestly, I think finding a supervisor is like there should be like a dating app for finding a supervisor, because it is very much about a fit. It's not just will they take me, but do I want to work with them, like for both, for the student and the supervisor. So I'd say the emails that grab me are the ones that make it very evident that they know what I do and that they have thought about what they're interested in. So there's, a bit of that, but also when they recognize that, we need to figure out if we are a good match. So, somebody who says like, I want to be your student right off the bat, and they've never even met me. Maybe I'm a complete tyrant. How do they know they want to be my student? The thing that grabs me is when a student that says, here's what I'm interested in. I see from your profile that you do related work around this. I'd really be interested in talking with you about whether or not there's the opportunity for us to work together and whether it would be a good fit. So that acknowledgement that, you don't want the first supervisor you can grab. You want somebody who's going to be the right content expert and the right chemistry, to be honest, to spend the next 5 years with.
That's great, Shannon. Thank you. So shifting gears a little bit, and again, reminder that you can put questions. If you have questions for Shannon, please put them in the Q&A box. But we have lots of questions to ask you. I don't think it'll be a problem to get some more information from you with our questions. So what has, over the years, what has made you the most successful? What aspects of your career development has made you successful over the past few years?
So honestly, I feel like my postdoc fellowship is really what set me up for success. And that's for a few reasons. One is what all postdoc fellowships offer, which is like dedicated time to focus on research, where you're not doing classes, you're not teaching, etc. So I think that's true of all postdocs. So I think they're good for that. But the fact that I was able to be embedded within a policy environment, So I wasn't still sitting in an academic office surrounded by a bunch of academic researchers. So I sat in on the meetings when we had a measles outbreak in Southern Alberta. I heard what the medical officers of health were talking about in terms of how to manage the outbreak. You know, I was invited to the meetings about, you know, hepatitis B outbreaks in the tattoo parlors. I was sitting in the room when they were saying, okay, here's the problem, here's what we know, and here's what we don't know. So I'm literally sitting there listening to them create research questions for me, you know. So I still sit actually at the academic or the advisory committee on immunization in Alberta Advisory Committee on Immunization. I still sit there and, you know, I hear, you know, we know this, we don't know this. And sometimes I actually know, they say they don't know it, but because I've been reading in the field, I can actually, you know, say, well, excuse me, actually, there's 3 studies that have been done on that, and this is what they've found. And so I'm literally feeding evidence to policy advisors like live. And then I am hearing the unanswered questions and going off and sitting down, thinking about how my team could answer that. And then going back to them and saying, I heard that this is a question. What do you think about working with my team to help answer that question? And honestly, it's so gratifying to do research that you literally know if you hand it to somebody, they are going to pick it up and do something with it. Like I say to my husband, I feel like a bit like a toddler, like instant gratification. I don't know what I do. Like, I don't know how I'd research otherwise anymore. I'm so gratified by doing research that is being picked up by people and being used. It's very fulfilling.
So can you tell us how you got into that type of postdoc fellowship? So, you know, how was it funded? How did you make the contacts? I know CIHR has funding for an embedded chair, for example, in health policy, but how did you make the contacts to actually get in the door?
Yeah. So I would say if people are interested in doing it now, actually will be further ahead than I was. What I did was basically a precursor to the CIHR Health System Impact Fellowships. So if you're not familiar with the Health System Impact Fellowships, they allow you to partner with like a policy environment or a practice environment to do exactly what I did. But that didn't exist when I was looking around. It was truly through networking that I had done, where I would meet, like for instance, Larry Svensson is the executive director of analytics for Alberta Health. And I would go to meetings and I would see him at meetings and I would introduce myself at meetings. I don't think we ever said more than 3 words to each other, but I literally would introduce him to like reintroduce myself to him at every meeting. And so when I was trying to decide about a postdoc fellowship and somebody said, oh, well, you know, that would be a good environment. And I'm like, well, I've met him. And so he remembered me, right? So it's not like it's not a nepotism thing. Like, it's not like, you know, he's my mom's brother or something like that. I've been putting myself in front of him for 3 years.
So you're saying stock policymakers.
Stock that's your message. That is exactly what I'm saying.
No, it's networking. We call it networking.
Yeah, we call it networking or stocking. But I've done that more than once. So there's another person, some of you may have heard of MacDonald, who's a bit of a guru in the vaccine world in Canada. I would see her at the Canadian Immunization Conference every 2 years. And every time I would have a conversation with her, and every time she had no idea who I was. And every time I would remind her who I was. And I did that for about like 8 years, like every 2 years for about 8 years. And then I finally thought, this is not getting me anywhere. So this is going to sound so contrived. I thought, what's a topic that she's an expert on that I'm really interested in? And I emailed her before the next meeting and I said, I'm wondering how you deal with the issue of pharmaceutical funding for research, because people are offering me money to do research and I'm not sure if it's going to taint my research. And I'm curious if you have some guidance you can give me on that. So it was like something we could talk about. She's like, let's have coffee at the meeting. So again, had to remind her who I was. But then we talked for an hour. And then the next time she had an opportunity that she was like, oh, we need somebody who's a nurse who does this kind of, oh, I met this nurse at the meeting. So it's a bit like stalking, just putting yourself in front of people and reminding them over and over again who you are and what you do, so that when an opportunity comes up, your face is in their mind.
Excellent. And what about mentorship through your career? How has that contributed to your success?
I'm an advocate of learning from both successes and failures. And so I spend a lot of time looking at what I think are good mentors and what I think are not good mentors, and looking at what I can take away from that. And, you know, my PhD supervisor was an exceptional mentor in many ways, but she had terrible work-life balance to the point that it impacted her health greatly. And I learned from her that, you know, here's the things I want to do. I want to make myself available to trainees. I want to be non-judgmental. I want to be open to hearing their ideas, but I'm not going to make myself available 24 hours a day, 7 days a week. I am not going to, you know, if they hand me something on a Thursday and say, sorry, I meant to get this to you 2 weeks ago, but I need it back tomorrow, I am not going to do that until 2 o'clock in the morning to get it back to them. So I learned from her, you know, here's the things I need to do, but here's the limits I need to set on how I do that. And so I now really clearly communicate with all my trainees about, this is where my boundaries are. You know, if you send me something at 5 o'clock on a Friday evening, I will not be looking at it until Monday. So you might as well hang on to it till Sunday night if you think you're going to work on it some more. You know, those are and you say that up front, and then the student is not spending the weekend like, why isn't she giving me feedback? They might as well have that paper in their hands until I'm ready to look at it.
So Shannon, can I ask you, you've obviously, I've known you for many years, and I know you've navigated your academic career with young children, as many trainees and new career researchers are doing as well. You know, other than the setting of boundaries, are there other strategies that you've used to help you with that balance?
Yeah. Again, trial and error. I think I figured out a few things. So first of all, just to give people the context, I had my 2 kids during my PhD. So it can be done, incidentally. Although I did it after my coursework was done. So postdoc fellowship is actually great for family life because you're a bit of a master of your own time during a postdoc. So I think that worked really well. Once I got into a faculty position, of course, less so because, you know, I have teaching commitments and things like that. I think it's really a matter of figuring out what works for you. So I have colleagues who firmly subscribe to the model of, I leave the office at 5 o'clock or whenever. I go home, I spend the evening with my family, and when the kids are in bed, I work for 3 hours. That does not work for me because I stop functioning at about 9 o'clock at night. Like I just do not function. So I actually, my approach has been to choose a couple of days a week where I'm just going to work late and get things done. And that means that once I go home, I'm mom for the rest of the evening. So for instance, if nobody has soccer on Monday, soccer is like our family's life. If no one has soccer on Mondays, I might stay at the office till 8 o'clock or 9 o'clock on a Monday. And then, you know, Tuesday I'm leaving at 5 because someone has a soccer practice. Wednesday, someone has a soccer game. Thursday, you know, and then I might do it again on Friday. So I like pick a couple of nights where I just like grind out that sort of heavy lifting that often doesn't get done until the email stops and the meetings end. And I could only do that because I do have a partner who is there feeding children and helping them with their homework. So that model isn't going to work for somebody who is a single parent or, you know, has a spouse with a similar work schedule. So that's what works for me is I just carve up my week and figure out when the work is going to happen.
Were you ever made to feel guilty about the way you work? I mean, obviously we all feel somewhat guilty, I think, about not spending more time with family or whatever our hours are, especially when grant season comes around. But did external people make you feel guilty about the way you work, and how did you handle that?
Yeah, it's interesting. So my family never made me feel guilty about it because I also was able to like leave at like I'm leaving right after this. I have to run home and do parent-teacher meetings, and then I'm coming back to the office. So I'm showing up for the things that I need to show up for. I certainly have felt pressure from academic colleagues about things like that. Like for years, I never talked about my family commitments. I would never say in a webinar, I'm leaving work at 1 o'clock in the afternoon to run home to parent teacher and I'll be back later. It was like this dirty secret that I had, right? But I think, you know, what's that saying? The proof is in the pudding. I'm being productive. I'm bringing in grants to the faculty. I'm putting out publications. I'm impacting policy. If that means that I leave at 4 o'clock because someone has an early soccer game, or I zip out to a doctor's appointment and come back, live with it. So I now actually am quite vocal about those sorts of commitments because I want to send the message that you can be productive and successful in your research program while balancing these other commitments. I think we should all be upfront about that. We shouldn't be embarrassed about the fact that we have a life.
And I think that's an important message, not just for family life, but I mean, those of us who are clinician scientists, we may get pressure to do more clinical work and see more patients. You know, that's at least in the physician world, that's a huge issue, right? Where the patients are never ending, your wait lists are growing, and somebody's going to say, well, why aren't you doing more clinical work? And the bottom line is you need to point to what you're doing and say, you know, this is my job, I'm producing. Sorry, this is what I do. And if you don't like it, too bad. And I think that goes for your kind of, I hate the phrase work-life balance, but you know, your life balance as well, is if you're producing in the hours that you're there and you're meeting the expectations and goals of the people who hired you, the people who you're accountable to, and you're making a difference, then you should not be made to feel guilty about the other stuff that you're doing.
Yeah, for sure.
Shannon, I've talked to several early career researchers about this topic, and particularly pre-tenure, they express that they have issues sort of taking a stand, like you said, you know, like I have a life and that's just the way it's going to be. When you think, so you obviously have tenure, so thinking back to those pre-tenure years, was there a difference in how you managed that? Or do you have any advice for anyone in that stage?
Yeah, it is a little different pre-tenure. And especially if you're growing your research program, so you don't have those deliverables to stand on, like you can't sort of point to the pile of publications and grants and say, I'm getting it done, leave me alone. Yeah, I don't know. It's tricky. Part of me wants to say, just, you know, put it out there, say it, but I don't know if that's fair. I just sort of avoided talking about it. I'd say, you know, I do have to leave at 4 o'clock today for another commitment, and I just wouldn't say what the other commitment was. I don't know if that was right, but I didn't say, you know, I have to get somebody for an immunization appointment or something like that. So I don't know, Leslie, what do you think? Do you think people should just like own it and put it out there, or is that too risky?
Well, I mean, I definitely think it needs to become more of our culture for that to be acceptable. And so, you know, I don't know about individual circumstances, you know, there may be repercussions that are sort of contextual, but as a whole, I think we need to be talking about that more. And actually, you know, just on my, you know, experience with CCH-CSP, that's one of the things that I found really extraordinary, is that whole attention to wellness and of the trainees. So it's not just focused on that academic piece as well.
Yeah.
So yeah, so I don't know the answer either, although I just think it just needs to become more out in the open and part of our culture to really respect that we're actually more productive as researchers when we feel renewed and rejuvenated and feel like we have, I don't like that word either, but have some balance.
No, it's so true. I mean, honestly, when I leave work after a grinding day, standing on the edge of a soccer field screaming, go wide, is like my stress relief.
Yeah, exactly.
Soccer moms are better than hockey moms, I hope. All right, so final question, because we're reaching the end of the hour, and then we'll wrap up. But I think this is a great closing question, is what sort of do you see as the next opportunity with regards to your research? And do you see any challenges on the road ahead for yourself?
I think some of my community partnered research is really sort of is hitting its stride at the moment. So for instance, I have this partnership I mentioned with a First Nations community, but I've started working with the Métis Nation of Alberta. And I'm learning more about allowing them to drive the research agenda a little bit more. So it was always like, I have an idea, I go to them, what do you think of this idea? Let's tweak it to make it acceptable to you. But now that those relationships are more established and they know what I do and I know how they work, I think the next step for me is truly to sort of give, nurture that opportunity for them to say, to be more in the driver's seat. So that's going to be a new learning for me, and I think will result in some important work. So I'd say that's one of the things. And I kind of forgot the second half of your question.
Challenges. Related to that, do you think there's going to be any challenges?
Well, certainly there is. I mean, and I think we're almost out of time. Feedback I got from CCH-CSP is to be careful to heavily invest in community-based research, particularly with Indigenous communities, because the pace isn't always what you want it to be. So projects sometimes move slower when you're engaging, right? So I've learned that I need to always have other stuff going on. So if this is going slow, I just redirect my time over here. And then when this picks up, I shift. So having a diverse portfolio of research, I think is going to be key.
Yeah, and that's a message not just for community-based research, right? I mean, I think that all of us have experienced that one project may stagnate for a while, may run into barriers, you work on something else. I think it's good to be focused, but those projects should be related, but it's good to have, multiple pots in the fire. I totally butchered that metaphor. Anyway, thank you, Shannon, so much for the opportunity to speak with you today. We really appreciate it. I hope our trainees get something out of it. This is all going to be archived as well for other trainees to watch if they weren't able to view it live. And we really appreciate learning from your experience. And hopefully we will all share another bitten ball in the Netherlands soon.
I hope.
Thank you, Leslie, for co-hosting this webinar.
And thank you both. Thank you, Shannon.
Stay well, everybody.
Take care.
And vaccinate your little ones.
Yes, soon.